Welcome to the Turd Nerds podcast. You are tuning in to the Functional Gastroenterology podcast with hosts Dr. Alana Gurvich, Dr. Ami Kapadia, and Dr. Rebecca Sand. Let us tell you quickly who we are. I am Dr. Rebecca Sand, a naturopathic physician, acupuncturist, and educator based in Portland, Oregon. My practice specializes in the microbiome, hormone conditions, and conditions of the gut-brain axis.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and holistic medicine with a special interest in digestive health, the microbiome, and its effects on our overall health.
And I am Dr. Alana Gurvich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, irritable bowel syndrome, and other functional GI disorders.
Okay, let's take the plunge into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Hi, everybody. Welcome back, Turd Nerds. We are going to try something a little bit different today. Oftentimes what happens when we get together, the three of us, before we go on and start recording is we talk about cases. I have a patient who, ... what do you think? And that's really how this podcast was born. So I thought today what we try to do is bring that conversation actually into the Turd Nerds collaborative so we can talk about cases and trouble pick. Dr. Sand was very, very generous enough to offer up some really good cases. So she's going to start us off and we're just going to break it down how we look at a patient, what we think about it, and then tear it apart between the three of us.
Totally. Yeah, and we do this all the time. So we might as well record it.
Yeah, take it away, Dr. Sand.
Well, before I start.
Yeah, always important.
Before we start. I want to give a shout out to all our Turd Nerd fans out there. We love you guys. Second, though, I had a block on my calendar that I think I sent to you.
Oh, I love this.
And I just put 10 a.m., whatever day it is today, turds. Capital letters, turds, big block on my calendar. And one of our lovely front desk staff that we all know and love saw that and messaged me and was like, excuse me.
What is going on?
What are you doing on Saturday?
Are you blocking out your morning bowel movement? What's going on?
2 hours.
For 2 hours.
For turds. So anyway, we gained another follower with that one.
Did you explain to her? Or you
No.
just left it up in there?
It.
Okay.
Yeah, that's just my turd time. No, I totally explained it.
I
Yeah.
would like to just leave it and see what people come up with, the theories that people come up with.
Yeah, I've also gotten, when clients or patients come and put on the intake form, how'd you hear about us or whatever, I've had a number of people now say the Turd podcast or the Turds. So even though we're called the Turd Nerds, I think people like to refer to us as the Turds.
I wear that badge with great honor.
Me too.
I feel like I've earned that
and
badge.
You two are my Turds.
Thank you.
Thanks,
Thank you.
Okay, well, enough about that. Let's dive in. So I have a case that was a little bit unusual. It wasn't, the standard textbook stuff, but this was a 35-year-old female who came in for morning vomiting.
And she's not pregnant.
Let me just say she's not pregnant.
Okay.
That's exactly. So can I just tell you, I hear that, and the first place my brain goes pregnancy.
Yeah.
The second place my brain goes is wake and bake. Are they smoking weed right when they wake up?
Great next question.
That's
No.
I've never heard that phrase before.
Oh, wake and bake?
Yes.
Yeah.
What year did you go to college?
I'm so out of touch with everything.
Miss it out. I would just keel over if I did that. But
I have many a years where I just did that.
Specifically, though, obviously, when we see people who are using marijuana and they have some sort of vomiting syndrome, but you've seen it specifically in the morning.
No, not for me.
So I feel like because marijuana is so available right now and so abundant in our culture and so heavily utilized.
You have to think about it as
for sure.
Right.
It's just like when I started practicing 20 years ago, it was a small subset.
Right.
But vomiting, cyclic vomiting, a
Almost
chronic
100% was cannabinoid hyperemesis.
Yes.
In my case.
Yes.
I think I can think of 2 people who had cyclic vomiting that it wasn't.
And
marijuana.
I can't remember. I don't recall the mechanism exactly. Do either of you?
I don't.
For another podcast.
I don't know the mechanism off the
Right.
top of my head, but what I do know about it is, one, it's very hard for people to stop, even though we know, that's what it is, because it helps to manage nausea. So
or
it's a
other
hard
symptoms
loop
that they're having.
And you really, appetite, whatever else it's helping with, stress management.
Right.
But it's not like you smoke or whatever and then you get sick.
Right.
It's not that direct. So it's really hard to even get people to do an experiment. They really have to be off it for like a month before we're going to see that cycle break. And that's a hard sell.
Right.
I will say when I was younger, before I got diagnosed with Crohn's, I was definitely utilizing marijuana a lot to control my appetite, to control my energy, to control my nausea, but also because I was really sick, and so I was hanging out with people who had energy like I had, which were the stoners.
Yeah.
You know what I mean?
Okay.
And I mean, it was like looking
you
back.
You couldn't pick a different group on?
No, I couldn't. Like, I literally had no energy.
Yeah.
So this was like the perfect friend group for me. And I'm like an extrovert. I just need friends.
Right.
Yeah.
And so, but I can remember like literally smoking too much and then starting vomiting, like the poltergeist vomiting, like cyclic, like hyperemesis made from marijuana.
Yeah.
It is not like a little bit of vomit.
Yeah.
It is like the poltergeist, like there's fluids. And I can remember going through this when I was really sick with Crohn's.
Yeah, it can be really rough. And I guess the pathognomonic trait of it is the hot showers to manage it. So it can be soothed with like scalding hot showers. And people
That's a homeopathic remedy just waiting to get used.
Yeah.
Is it a vasovagal?
I don't know.
Okay, so
but
that
I remember
one we
in
also
school
need to know
learning
the
that
mechanism.
bit, and people will show up to the emergency room like red because and their skin is like hot because they've been in hot showers trying to manage it, and they get freaked out and whatever and want to go to the emergency room. So yeah, if that soothes it, have that on your differential, even if they're not coming clean about,
how much they're smoking.
Totally.
And from what I understand, it's actually not quantity of smoked, it's regularity.
Totally.
So even somebody who like tokes just at night or tokes just in the morning, they can present with that cyclic vomiting.
So they might not have made the connection.
I like that you're up on the lingo here. Learn new stuff about you every time.
By up on the lingo, you mean using the lingo that we used 20 years ago?
I would not have said tokes, but, that's the correct term. So, okay, so back to this patient who was not using marijuana in any form.
Okay, great.
She was not pregnant. Anyway, she really didn't have, like, a ton of other gut symptoms going on. Like, she had some diarrhea on and off, which was significant, but we were able to patch it up a little bit with psyllium husk.
Oh, okay.
So it was really just this vomiting. So where I started with her, I knew she wasn't eating breakfast in the morning, and I was like, maybe it's a blood sugar thing.
That's also another great thought.
Totally.
Yeah.
So, and it was very hard for her to be able to eat in the morning because she was so sick, and she would throw up, but not much because there wasn't much.
Can I just so she would wake up, like brush her teeth, vomit, or wake up, do her morning stuff, all of a sudden she had this urge to vomit?
Pretty
what was
close
it like?
to waking up. And it wasn't always vomiting.
Okay.
The vomiting was like maybe a couple times a week, and sometimes triggered by brushing her teeth just because of a gag reflex.
Yep.
But it was very close to waking up.
So then the other thing that's floating through my mind right now is vagus nerve.
Yeah.
Yeah, and we've had patients with histamine issues where they have this early, I don't know the mechanism exactly, but it improved with that. So.
Yeah. So I started with the blood sugar thing, and I was like, just see if you can cram anything into your face in the morning. If a smoothie sounds good that's like cold, or saltines, like I don't care. Just get some calories in and see if we can stabilize thing. Didn't do anything, it made it worse.
And then, high protein at night is the other thing that I would think about to try to control it.
Yeah.
But
we tried that. She did some, I think, like Greek yogurt before bed with fat and protein. Didn't do anything.
Okay.
Like there was no, I even did a fasting insulin and nothing really showed up on that either. So not that that's definitive. We started with that. Then we just went to like ginger prokinetic type stuff. Dosed before bed. And then first thing in the morning, if there's any form she could get it in, like a tea or a candy or something.
And she would, just to clarify, she would wake up, have nausea, maybe vomit, but then things would get better as the day goes on. This was a morning thing.
It wasn't as big of an issue. There was some, if I'm remembering correctly, there was some like later, but it was really the morning that was really rough. Yeah. And no like food intolerances, no bloating, no heartburn, just occasional funky bowels, and really the nausea was like her problem.
And do you remember, like, was it years of this when she came in?
It was about 6 months.
Okay.
Yeah, it wasn't over a year.
That seems terrible.
Yeah.
And then what pharmaceuticals was she taking at bedtime? Ooh, did I get something?
No.
Oh,
or stress levels in the last 6 months?
Okay, wait, let's go one at a time. We're bombarding Dr. Sand. I did do like meds and supplements, and she wasn't really on much. Okay.
I think she also had some fatigue, so we did some she had the classic nutrient deficiencies.
So weird. I never see patients with fatigue.
But I was like thorough review of systems, like what am I missing here? What's going on? And she had like low normal B12. I think her vitamin D was low, like everyone up here. And we corrected those and the fatigue got better.
Yeah.
And
that
then
usually doesn't happen with most of our patients. So that's good.
Oh, I see it help.
I see it
a
help
little.
some.
It's usually a drop in the bucket.
I feel like it depends how many other doctors they've seen it before.
That's true.
Yeah.
That's
and
true.
I should say this person was like
Occasionally it's a
so
miracle.
compliant. She did everything. But
Yeah.
we moved on to the prokinetics and like ginger and artichoke and just seeing if we could move things down and get like the retrograde flow fixed for her. That didn't do anything. It did a little bit, but it was also really hard to get ginger in the morning when she was feeling kind of crummy. So I tried some like gut soothing herbs, like throat coat tea, really, really strong, to just see if that
like
could
2 tea bags.
Exactly.
Yeah.
And like
Slippery elm
4
and
ounces
stuff
of
like
water.
that.
Yeah.
Aloe.
Marshmallow.
Totally. Yeah. Nothing.
Nothing.
I think she even was like sucking on DGL.
Yeah.
In the morning, nothing.
Just out of curiosity, did you do any GI functional workup?
Yeah. So then I was like, well, intra-abdominal pressure. You know, I wonder if there's a SIBO thing. And SIBO can underlie a lot of other things that can go wrong. So let's start there. She was hydrogen positive.
But she wasn't having diarrhea. She was having pretty normal bowel movements.
She had diarrhea occasionally.
Okay.
Yeah, but it wasn't like, she wasn't too bothered by it, and it wasn't like the biggest problem. It was really the nausea, and there was nothing in between on the tube.
Yeah.
But I was like, you know, maybe because there is some downstream stuff and definitely the upper
Yeah.
GI stuff, let's just do SIBO testing. I've seen it before. So she was hydrogen positive, not extreme, but we went along treating it. So we did an herbal antimicrobial phase, and then we went on to like the prokinetic phase. Not a ton of change, a little bit of improvement, like maybe less frequency with the nausea, if I'm remembering. And then I met with her recently, I think like this week actually, to talk about like, should we move on to the gut repair? Like, should we address inflammation, leaky gut, repopulating the microbiome after we do these SIBO treatments, or are we missing something?
Right.
You know, that could be going on. Interestingly, classic presentation of bile acid malabsorption appeared.
What do you mean? Like, so all of a sudden, out of
Stools
nowhere?
got a little worse. It's sticky.
As soon as you treated with herbs?
Yeah, like after like phase 2 of our SIBO protocol. So like I put her on, I think like the ginger modal agent we all use a lot.
5-HTP,
Yeah.
But her nausea didn't get better.
The nausea was okay, but it definitely was not resolved. Like there was a little bit of traction, but it's hard to say.
So she actually got worse. She had more complaints.
Bowels were,
This happens. I mean, here's what I'm going to say, guys.
It can happen,
That's why I'm talking about it.
I mean, what's interesting about doing medicine, and this is our medicine or regular medicine, is even if you have an algorithm or you don't, every patient is an individual. The best you can do is take your brain and your history and your training and apply it to the case you have in front of you, right? But oftentimes it's wrong.
Yeah. Or, well, I think in her case, so we talked about how she has her gallbladder, but how the liver and gallbladder concentrate bile at night. And I was like, do you have a bile taste in your mouth ever with this? And she was like, well, no, not really. But she absolutely like biley poops. They were sticky. She was wiping a lot, like sticking to the toilet, like all the classic stuff.
Yeah.
So I was like, let's maybe move you on to the gut repair because we definitely know you had SIBO.
Yeah.
And, you know, it wasn't severe enough that I think we would need more treatment with that. It should have taken care of it. But let's add in cholestyramine and see if we can just get things. So my plan, and we'll see here, is if we add in the cholestyramine, finish treating the SIBO, can we kind of get her off of it by treating the underlying cause? Because cholestyramine works pretty well.
Cholestyramine does work really well. It just tastes so bad.
Yeah, but I'm wondering, dosing at night, if we can kind of curb.
Just one dose at night.
Yeah, if the vomiting and nausea is related to that bile concentration.
Okay, so
night.
Can I tell you what I think is what we need to talk about in this case? One, I think that we need to have a conversation about gastroparesis. Like that is something that can cause vomiting.
Totally.
It could be cyclical. The problem with gastroparesis, and it is a problem, is the testing is very specific, but it's not sensitive. So I've heard as much as 75% of bowel emptying studies are inaccurate because they don't pick up bile dumping, they don't pick up stomach dumping enough.
Yeah.
So that's a problem with gastroparesis.
We should do an episode on gastroparesis.
It is so complicated.
I have a couple patients, one in particular who acupuncture is the only thing that's worked.
That's the other thing I was thinking about for this patient is, have you tried acupuncture with her?
No, she's not a fan.
She's not local. Oh, she's not a fan.
Yeah.
What about your abdominal massage?
We haven't gone there yet. Yeah, I don't think. Maybe we did just start adding it in, actually.
Because maybe there's just like some stuckness, you know?
Yeah, I mean, a lot of people, their stomach is like really tight in the diaphragm, and that could totally make a difference. But the morning piece.
Yes,
like,
the morning piece.
You know, so I think the bile thing could make sense.
Yeah.
But why did it kind of erupt more with a SIBO treatment? Like, are we just stirring the pot in there?
Yeah.
And then you still have to figure out why does she have that, if that's what it is.
Yeah, the SIBO or the bile acid?
The bile acid.
Well, my thought was SIBO.
From the SIBO.
Yeah.
But then you would think it wouldn't get worse with the SIBO treatment.
But you change the microbiome,
so
and any change can change.
Yeah.
You know, and there is that. So I guess
Or did we release biofilms? You know, like, did we stir the pot with some biofilms?
Which then goes back to changing the microbiome.
Yeah.
Does she have any other neurological neuropathies?
How old is she?
36.
Yeah.
Okay.
Super young, super healthy. Like, she takes good care of herself. Like one of the most compliant patients. She takes everything to the T.
I don't know, Dr. Kapadia, food allergies?
I mean, they can food sensitivities can cause any symptom. Yeah. It's just I've moved further away from having people do more involved dietary interventions. That being said, I think there's a place for considering it. I mean, some of the very super common, like, can you remove dairy for 2 weeks? You know,
I'm not sure.
And just stop there
because dairy.
To see.
Yeah, she tried before she found me to see if there was any correlation with diet, and she couldn't find a thing. Like, like literally nothing that made a difference.
Okay.
And, you know, I think a lot of our patients try diet because it's the first thing that they can. It's maybe one of the only things they can do.
It might be. Okay, go ahead.
No, you finish, and then I have another
Well,
thought.
it might be worth asking. I feel like cow milk sensitivity is one of the, because there's a lot of, you know, scientists and people in our area would say adults aren't really meant to drink milk, right? So maybe there's fermented dairy and such that I still think can be healthy for a lot of people.
It's one of my faves.
But who knows what kind of intervention she did. So it might be worth asking, like, what did you actually remove? Because some people think, like, cheese isn't dairy or something
I mean,
like
I do think
dairy.
But I've moved away from doing all kinds of complicated things, but I do think also there could be a stress nervous system component that we could talk about if you eliminate other things.
I think that I like the line of thinking that you're going on, where like you said, you know, maybe high protein. She did Greek yogurt. I think it just makes. And
she does eat dairy
when I have people take out food intolerances or potential food intolerances, I say a month. I need a month of nothing.
Yep.
I expect you to feel better right around week 3.
Yep.
You really get your footing week 4, and then you reintroduce and see what happens.
Yep.
So I think that's super useful.
Yeah.
The other thing that I think about, going back to like gastroparesis and acupuncture, and her not liking acupuncture, is when I was pregnant. When I was pregnant with my first, I was like in my 30s. I like loved work. I was like, why do I need a baby? I don't need a baby. You know what I mean? So I got my baby snuck in, and now I love my baby. Obviously, she's 11. But I had such bad hyperemesis, right? And I went to see this incredible acupuncturist at the clinic that we all worked at, and she put needles in me, but she put tacks on me, right? So like tacks are little stickers with really teeny tiny needles on them.
Yep.
And I have my kids so well trained where they're like, Mommy, I have a headache. Can I have some tacks?
Yeah.
But what happened, they're awesome. She put tacks on me, and what happened was my nausea disappeared. And I was really early in pregnancy, and I was like, oh, I must be miscarrying. You know, and I was like, not attached. I was like, I must be miscarrying. And my nausea completely went away, and I did not miscarry.
How long did she keep the tacks in?
I did not miscarry. And so what happened was I think she probably placed the tacks at like 8 weeks, and they're sticky.
Yeah.
I think at 16 weeks, I wasn't rubbing them, but I was showering. I was doing, at 16 weeks, one of the tacks fell off, maybe 14 weeks.
They stay in for weeks?
Weeks. One of the tacks.
They didn't do that for me. I replaced mine.
When one of my tacks fell out, my nausea came right back.
So I did that. I was working, and I was like, I'm just going to take it off. It's been on here for a while. And I was first trimester too, and I took it off, and I had to run to the bathroom.
Wow. Yes, to vomit.
Yeah, something along those lines.
So patients like this who don't, like, we have, I think that for gastroparesis at least, there's something like 26 different studies looking at acupuncture with steam, without steam, these points, those points for gastroparesis. If a patient is very reticent, tacks are incredible.
It's a good idea.
Yeah.
I also would, on a different note, I would also like to give a plug for neural therapy because, and I think I want to do an episode just about neural therapy because I use it for my acute acute GI patients all of the time and my chronic GI patients all the time.
It's
but
scarring.
it is one of the tools that we have to reset the nervous system, right? So I'm listening to a case like this that's complicated, that doesn't make sense, it doesn't fit anywhere, and something changed within the 6-month window. Like 6 months ago, she wasn't having this, now she is. That allows you to take a neural therapy intake where you're like, what changed? Did you get a scar? Did you have some trauma? How can I talk to the nerves directly to reset the innervation? And I don't actually think of a different mechanism. Like neural therapy is the thing to reset the nerves. So is it a microbiome component? Did something happen with the SIBO treatment? Is it a nerve component? Is it anatomical? Like,
I asked her if she, like, the stress piece, life isn't very stressful for her. And I was like, are you waking up feeling like that sense of dread or stress?
I find that very hard to believe for someone living in current society. So I would like dig into that.
It depends on how much social media she watches. She might not know what's happening in the world.
I know of occasional people who don't feel, but that you can't be alive without, you may not be aware of it.
She's a pretty even-keeled
and that might be because it might be all getting stuffed in. I don't know.
That's a possibility.
I would dig in a little more.
I usually do.
Okay.
Like sometimes I'm like, am I a doctor or a therapist?
Yeah.
You know, like,
that is the thing that
I need to
you probably dug in
a little.
Yeah.
But it just hasn't seemed like a frank, cause of what's going on, and nothing changed 6 months ago. Because one question I always ask my patients is, why do you think this is happening?
Yeah, that's a great question.
It is a great question. One, because they feel heard, but two, I get some really solid info.
Yep.
That I didn't think to ask, and nothing. Like, it's a total mystery, so... Yeah, but the neural therapy is a good idea. We'll see what the cholestyramine does.
I would always start with, see what the cholestyramine does. Start with the tacks.
Yeah.
Tacks are cheaper.
Yep.
You're not breaking the skin. They're not as painful.
They're
like
awesome.
me convincing them to inject.
But why the morning? Like no other time of day.
I know.
Yeah. So I don't know. I'm thinking, microbiome testing. If
something... there could be another gut bug.
She did have SIBO. Like she did have some kind of dysbiosis.
And if SIBO didn't respond, fungal testing.
Yeah.
Because it could be SIFO.
Yeah.
Like start there, work your way down. It does seem exceptionally large bowel. And then the other thing that's like something to think about is, have you checked for sliding hiatal hernia or hiatal hernia syndrome?
I don't remember if I did, but I totally could. And do some visceral.
Yeah, do some visceral. The hiatal hernia is like, I get caught on hiatal hernias. Like I will adjust them often. If I find them, I will adjust them.
Yep.
I'm a little bit more intense in my adjustment. There's much more gentle ways to do it. For some people, it's like, oh my God, I can take a breath.
It thunks down sometimes. It's wild.
Yeah.
Can you actually, I know we've gone over the mechanism to work on it, but can you actually tell by palpating if they have one?
When I'm palpating for a hiatal hernia, I'm looking at the costal margin on the right side. And they'll have tenderness and they'll have tenderness of palpation right there when you're in there.
Okay.
And then it feels rigid. That's what I feel. What do you feel?
It's just like the stomach and the diaphragm, I can't wiggle out. Usually I can separate them and get some mobility, some twist with the stomach. And then if it's just completely stuck up there and the symptom picture, even if it's not a hernia or a sliding hiatal hernia, they probably will get benefit from an adjustment. If it's that fused up.
Right.
And I also want to explain to the audience that we're not talking about, what we're talking about is hiatal hernia syndrome, not like, so you won't necessarily see on endoscopy a herniation of the stomach, but what you'll
unless
see,
you get lucky,
unless it's severe.
Yeah.
There are lots of people who fall under hiatal hernia syndrome, which is like it's moving a little bit more than it should. This is viscera. It should be like butter between wax paper. Everything should be able to move, but it's not moving, and so that's what we're correcting. Because it's not like a full hiatal hernia that we're seeing on imaging.
And even if I don't necessarily need to have that diagnosis to be able to do some kind of adjustment.
Right.
I think a lot of people hold tension in their diaphragm, and getting things more mobile can really help.
I also just think visceral helps.
Yeah, I know. It's one of my favorite things to do. I have a whole nother case we'll talk about where
I do
not
think
to spoiler alert, but
I
did something.
I mean, I don't know that everyone knows what that is, Dr. Sand. Do you want to talk a little bit about what your technique is?
There are a lot of different types of doing it, and I was trained in a couple that I do, but I kind of describe it to my patients as it's like chiropractic for the guts. We're kind of just doing these adjustments. They're not the high amplitude, whatever.
Yeah.
It's
like
gentle.
Grade 5.
High velocity, low amplitude. Adjustments. Sometimes in my case, they're really slow and gentle, almost like melting butter.
Yeah.
I can just see something. And sometimes it really is almost like a thud, and then sort of a gush of contents are able to move through, like whether the stomach, can empty or something with the ileocecal valve. I just see like gas, and I'm like, you are probably going to pass gas soon.
Yep.
And that's great. Like, let's get it out. Or I'll feel stool in the descending colon just like move into the rectum. Where it was just kind of stuck. But a lot of times just getting better circulation, getting things better aligned, and really I'm trying to focus on getting a little more mobility in those organs, for whether it's due to adhesions, internal scarring, stress patterns,
inflammation.
I have a patient with severe scoliosis where she really benefits from it.
Yeah.
Because the way her organs are just sitting in the cavity is twisted.
Yep.
Because of her anatomy.
Yep.
So I pair it with my abdominal therapy. So I'm trained in both, and I use both. I kind of just bring whatever that body needs.
A little bit separate out for me, because this is something where as a clinician I struggle with what referral I want to put in.
Yeah.
When would I think about putting in a referral for my abdominal as opposed to visceral?
It's person to person. So I feel lucky that I can do both, because sometimes I'll think like, oh, I'll pull from Maya on this one, but then I'll get in there and see their stomach is like really needs some adjusting, and then I'll do that, then I'll get back to the Maya.
Okay.
Generally, for just kind of circulation support, my abdominal can be really helpful for anything like fertility, menstrual stuff, really fertility in all genders. It's great.
Yep.
If people have adhesions, it's also great, but sometimes I may need to go in and do a little bit higher force with visceral first.
Okay.
So
you would put
really
visceral as something deeper. It's higher force.
Honestly,
That's what.
Not necessarily, because sometimes I can work on the fascia to get an adjustment. Sometimes people, like if I do too much probing in there, they'll rebound with guarding.
Yeah, for sure.
And then they'll feel worse. And sphincters especially can kind of swell up a little, and it will get worse functioning with too deep a palpation.
And then how do you layer in? This is something that I feel like I could just spend hours just trying to understand.
Yeah, maybe we should do an episode on this.
How do you layer in acupuncture? This is the last thing. This is the last question I'll ask.
Yeah.
But how do you layer in these three very directive GI-based modalities?
Yeah.
Where does acupuncture come into this?
Yeah, well, often I'll let the patient pick, because
Okay.
I feel like if they resonate with something, even if, with my sort of rudimentary description to them, let's start there. And then I'll say, depending on what I'm treating, let's get some booked, like 4 or 5 sessions booked, and see what kind of traction, see if this is something your body responds to. Because not everyone responds to acupuncture.
Yes.
Not everyone responds to visceral. But let's shop around and see. Or if I do a phys exam, and I'm like, this is really tight in here. Let's see if we can just like add some mobility with it, with a couple sessions, or even just today, like 10 minutes. Let's see what traction we can get. Let me know what you feel after a session and go from there. It's a little bit of trial and error and see what the body responds to. Yeah, that's a great
answer, actually.
But if I know they have tension, I think both. Like, why not?
Yeah.
People.
I really enjoyed this.
Yeah, good case.
Yeah, great case.
So you're going to report back to us on...
Yeah, I hope so. Yeah, I'm curious how the cholestyramine went. I asked her to send me a message, with like one packet. I was like, if you need more than 2 packets of it, let's chat.
Yeah, because then you move to the pills that are higher dose, but easier to take.
Yeah, and it's so gross.
You guys have tried it or no?
No.
I have tried. I used to take it before I would fly. It was like how I prevented getting sick on the plane. It worked like magic.
This is not a normal.
This is not a normal indication, but it was very effective. Orange chalk.
Yeah, and it stains the glass you're using.
Yeah, I mean it's there's nothing lovely about it. Orange chalk.
It's gross.
Yeah,
but it works.
This was so just a quick little recap, not rehab. Quick little
rehabs for the morning.
So
wake and bake.
Yeah, exactly.
Your morning nausea. We're thinking possibly dietary, possibly pharmaceutical, possibly blood sugar,
gastroparesis,
cortisol stress.
Microbiome issues, neurological issues. So basically, we're thinking everything for everything.
Or bile dumping.
But it would be easy to get a gastric emptying scan as a sort of routine test just to rule out a piece of although it doesn't fully rule it out, at least get some data. If it's positive.
If it's positive, it's definitively positive.
Yeah.
If it's not positive, it's just not definitively positive.
Yeah.
One of my colleagues has a new gastroparesis case, and he did a scan and it was positive. Morning vomiting, regular vomiting.
Yep.
But then they want to put him on crazy drugs.
Totally. Yep.
So
lots to try before that. They work, but
they have a long list. My colleague was texting me and he was like, what about this drug? And I was like, it absolutely can work, but it absolutely has a long list of side effects that happen frequently.
And they're serious.
Serious.
Referencing back to the prokinetic episode. Check it out. We go through them. They're scary.
Yep.
Thanks for joining,
All
everyone.
Right. Thank you.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.